Shall we start? Okay. Okay, so good afternoon, everyone. So finally, this is our last topic for this semester. Inshallah, after this topic, you can focus on studying your other courses. You can start studying for your final exam. But this is the last topic for this semester. And this is one of the most important, one of the most sensitive topic, yet very important, especially for nurses. And I'm talking about the topic on loss, grieving, death, and dying. Okay. And before we start our lecture on death and dying concepts, these are our student learning outcomes. We're going to describe what are the types and sources of loss. We're going to describe the stages of grieving. We are going to identify what are the symptoms of grief, factors affecting grief process, developmental concepts, and most importantly, what is the role of a nurse if we have a patient who is dying? And of course, we're going to discuss exactly what are the things that you can do as a nurse. But before to discuss our topic, I'm going to show you a photo. I'm going to show you a photo of the different phases in the hospital. You know, when you work in the hospital, the good thing about being a nurse is when you go to the hospital, you will witness different phases of individuals in the hospital. What I'm trying to say is you will observe different journey in one's life. From the moment the child is born, if you are assigned in delivery room, it's a joyous moment. Okay. However, in most instances, the hospital is filled with sad moments. Why? It is where you can see sick people. And most importantly, you will surely see dying people. And as a nurse, it is very important for you to be ready, to be prepared emotionally, psychologically, because the concept of death and dying, or witnessing someone dying, or someone's death, is emotionally bothering. And this afternoon, we're going to discuss what are the things that you need to learn if you experience or if you have a patient who is facing death and dying. Okay. Now, before we discuss in details what are the nursing interventions if you have a patient who is dying, let us first understand what are the concepts associated with it. And one of the most common important concept or term that you need to learn and understand is the term loss. Okay? Loss is defined as actual or potential situation in which something that is valued is changed or no longer exists. I know even with ordinary people, we experience a certain degree of loss. I know even you yourself, you have experienced someone who died before. But the book says that loss as a potential and actual situation may not necessarily death of loved ones. Someone could also experience loss if someone experienced changes. See this one? Changes in self-image can also be considered as loss. What do you mean by that? For example, when you're getting older, what will happen? You experience some changes in the texture of your skin and you are bothered. You yourself, you are experiencing physical loss. Okay, that's an example of loss. Okay, what else? If you had a surgery, if you had an accident, and you experience some scar or mark on your skin, and it doesn't look good, what will you feel? You feel that something is lost. Again, loss is not necessarily a loved one who dies. It could also be a change in your body image. It could be change in your environment as well. For example, you have been living in Miswa for 20 years and suddenly you have to move to Sohar. What do you feel? You feel sad. And that sadness is because of loss. And we call it as loss related to environment. Okay. Now, loss can also be related to external objects or inanimate object. This one. For example, you have a precious things. You have your cell phones. You have an expensive jewelries. And suddenly you cannot find it. It is also an example of loss. Okay? Or even loss of your pets. Or loss of your favorite clothing. Those are example of loss. But among this type of loss, of course, the most heartbreaking is when you lost loved ones because of death. And I know when you work in the hospital, I'll tell you, you would experience, you will witness someone dying. You will witness your patients die. You will experience death in your family members, and you need to be ready emotionally of that occurrence. Now, what will happen if someone is lost? Or what will happen if you experience loss? So our normal tendency, our normal response to loss is for us to develop emotional experience. We call it as grief. This one, we call it as grief. When you see someone is grieving because someone from his family died, that is an emotional experience. Or she is crying because the pet dies. She is sad and she's crying because the cell phone lost. We call it as grief. Okay. Now, one good important of grief is bereavement. This is the subjective response. When someone dies, the family will bereaved or will undergo the process of bereavement. And this type of grief is subjective. Okay, subjective. For example, when someone dies in the family member, you would personally see the family members cry and mourn. They're crying for 1 week, for 2 weeks. You cannot talk to them because they are sad. They cannot eat because they keep on crying. They are mourning. We call it as mourning. It's a form of bereavement and it's a way of resolving the grief. Mister, is it normal to cry? Is it normal to be emotionally sad when someone died? When someone lost? Yes, it is normal. That's part of the process. It's one way of resolving the loss. We call it as mourning, bereavement. It's called it as grieving. Now, mister, someone in our city, the husband died 1 year ago, but still the wife is still crying. Is it normal for that wife or for that person to experience grieving for a long period of time? My answer is no. Now, to answer that question, grieving process is divided into three. Okay? It's divided into three. This one. And we have abbreviated grief, we have anticipatory grief, and we have complicated grief. Now, these are emotional experience, but how do they differ from each other? When we see abbreviated grief, this is just a short emotional experience related to loss. For example, 1 day or 2 days, when someone is lost, or some important pets or things is lost. For 1 day, a person might experience, a brief emotional experience or sadness. Just a brief one. Okay? We call it as abbreviated grief. But after a day or after a few hours, when the one that is lost is replaced back to that person, the person becomes okay and happy again. Abbreviated, short, but grief. Okay, we have this anticipatory grief. What do we mean by anticipatory grief? Anticipatory grief, it is an emotional experience in advance. I'll give an example. The wife has a cancer and is in the hospital. Even if the wife is still alive and the wife is still in the hospital, the husband starts to be emotionally disturbed. The husband starts to feel grieving even if the wife is still alive in the hospital. We call it as anticipatory grief. There's no actual loss yet, but there is an advanced emotional experience. Okay. Now, is it normal? Yes. When does grieving process becomes abnormal? Okay. Abnormal grieving process is called complicated grief. And normally it happens when the grieving process exceeds 6 months. Normally, when someone dies in our family, we experience grieving process. We mourn for the loss of our loved ones for about 1 to 3 months. However, after 6 months, we should be able to what? To emotionally recover. But there are some people who are even experiencing grieving, mourning, or bereavement more than 6 months, and it is no longer healthy. Why? Because that means the person is not able to cope. The coping mechanism is not there. The person is not able to cope for the death or the loss of someone. And that is pathologic. That is already a problem. Okay, now, this is very, very important. You know, when someone is dying or a family member is experiencing a dying family member, or if a person is dying himself, person will experience or undergo different stages of the grieving process. Okay. Now, whether you are the one who is dying or whether you are a family member whose family member is also dying, all of you will experience this grieving process. And as a nurse, you need to recognize at which stage the patient or the family is in the grieving process. You need to identify where is the patient now in the grieving process. And why you need to learn that? Because in each stages of the grieving process, there are a corresponding nursing intervention that you can provide to your patient. Okay, the first stage of the grieving process is denial. What is denial? Do you know what is denial? When you are denial, what do? You can type in the chat box. When you are denying, what do? Who cheated in the exam? I did not cheat. You don't accept. Very good. You don't accept. You don't believe. Very good. You refuse to believe. Okay. Those are the different characteristics of denial. When a person experiences, for example, a person is diagnosed of cancer and a person is given 3 months to live, the doctor would say, okay, you have a cancer and you have 3 months to live. The moment you've learned that you are dying, you will observe these stages of grieving. The first stage is denial. So how do you know if a person is denial? The patient is going to die in 3 months, but she is denying. How do you know that she's denying? She doesn't believe. She refuses to believe. Okay? The patient doesn't accept. That means a person is denial. So how do you know if a person is denial? How do you know? Maybe the person will not go and visit the doctor. No, I don't have a cancer. I am not sick. I am healthy. I'm not going to look for a doctor. I'm not going to go to the hospital. I am well. I am healthy. The person is denial. If your patient is denial, what are you going to do? Okay, I need to ask someone from the group to share. I'm going to call one student who got one of the highest, Bushra. Bushra, can you open your audio? Bushra. We don't have Bushra here?
Yes, doctor.
Bushra, congrats. You're one of the students who have, you're the only Bushra in the class, right?
I don't know.
Yeah, I think you are because Alcatri, yeah. You're one of the students who got high mark. I do not know if it is 38 or 39, but anyway, congrats. Anyway, I'm
Thank
going to
you.
go back to my question. Once a person is diagnosed or the family member is diagnosed with a certain disease. Okay. The first stage that that person will undergo in the stages of grieving process is denial. The person will not refuse. Okay, we will give you a scenario. I am the patient who was diagnosed and was given 3 months, and the doc and the nurse advised me to go to the hospital, ask the doctor, take some medication. Okay. But I no, I'm not going to go to hospital. I'm not going to look for the doctor. I am healthy. I feel good. I do not feel ill. As a nurse, if you have a patient who is in denial, what will you do? What will you do? Bushra. Okay, who can give me an answer? Any volunteer? Okay, I'll call another student who got one of the highest mark, Abdihal. Where's Abdihal here? Abdihal Al-Masudi. Abdihal. What happened to my students? Yes, Abdihal. What do you think should you do if your patient is denial and doesn't want to believe that he is that that the loss is happening or that the patient might die? What do you do if the person is denial? Mhm. Okay, I think I need as a boy. So Laiman, can you open your audio?
Yes, doctor.
Yeah, there's no right or wrong answer for this question. As mentioned earlier, when a person is experiencing loss, or if a family member is experiencing loss, the person or the family undergo the different stages of grieving, from denial, anger, bargaining, depression, and eventually acceptance. We said that during stage one or the denial period, a person who is experiencing a loss refuse to believe or do not accept or refuse to believe. If you are the nurse of this patient, what will you do?
Try to explain the situation more.
No, I'm not sick. I am healthy. Nurse Sulaiman. You see, my body, I am well. I am fit. I am not sick. I'm not going to die.
Okay, you will not die.
See? Okay.
I
What will
try
you
to
do?
tell someone who is close to him to tell him that he is his situation.
But no family members is there. Only the patient and you, the nurse.
I
No, I
don't
need
know.
to get out of the hospital. I am healthy. I'm not sick. The doctor is lying. In fact, I'm going to visit France or Europe next month because I'm healthy. What will you do?
Maybe there is a medication or something.
Okay, medication.
ما أعرف
Thank you
والله.
so much, Sulaiman. Okay, this is a real scenario that might happen in the hospital. And for sure, when you work as a nurse, you will experience people who are experiencing loss, who are in denial. Now, the only thing that you can do is support the patient, because these are normal process that the patient will undergo. These are normal process. You cannot avoid it, you cannot stop it, but you have to support the patient. Okay? But of course, you do not support saying, yes, I can see that you are healthy. I think the doctor is wrong. You are not sick. It's not like that. You support the patient, but do not reinforce his or her denial. Do not support his denial, but make sure to support the patient. You cannot stop it. There's no medication for that, because that is a normal process. First is denial. Now, the next stage of the grieving process is anger. After the patient, refuses to believe, he or she will undergo the anger stages. It is where the patient might shout. It is where the patient might direct his anger to the family member, to the doctor, to the nurses. He will fight or she will fight with some healthcare workers. And that means that the patient is in the stage 2 of the anger, of this stage 2 of the grieving process, specifically on the stage of anger. My question is it normal to be angry at that point? I need someone who will help me to give or her idea. Shaika Al-Kuwaiti. I need Shaika. Shaika, can you open your audio?
Yes, mister.
Okay, as mentioned earlier, the second stage is anger. It is a point where the patient directs his anger towards staff, towards family members, towards healthcare workers. Do you think it is normal to be angry when you are grieving?
Yes, at the first moment it's normal.
So, I agree with you. It is a normal response. It's a normal process. When you go to the hospital, you might encounter patients who are angry. They're
Yes.
experiencing loss. They are angry, and you see it's normal. So, how do you support this patient?
Um, Maybe I will talk to him and say, for example, this is your luck, and you have to you have to cope with it.
Mm-hmm. So
Uh,
that means you're going to talk to the patient, provides emotional support to the patient, and
yes,
perhaps you can teach some coping strategies to your patient.
yes, and if it
Okay,
is
Mary. Mhm.
if I cannot speak to him directly, I try to ask, for example, any family member or any other person who is close to the patient to
Mhm.
try to relieve this anger.
Very good. Thank you, Shaika. Anger is a normal response. Anger is a normal response to a feeling of loss. And you expect some patients who are experiencing loss to be angry towards the family, towards the nurse, towards the doctor, and etc. So what do you do? Shaika says, I need to provide emotional support to the patient. Should I shout back to the patient because the patient is shouting at me? No. Should I feel angry towards the patient because the patient is shouting at me? No. Because as a nurse, you know that anger is a normal response to loss or experience of loss. And what can you do is to provide emotional support to the patient, talk to the patient in a manner that she can control his emotion, and you can also ask the family members to talk to the patient and provide support to the patient. It's a very good nursing intervention. Thank you so much. Now, after denial, after anger, the patient might get into the third stage of the grieving process, which is bargaining. What do you do when you bargain? Let me see. What do you do when you bargain? What do you do when you bargain? Any idea? Can you put it in the chat box? What do we mean by bargain? Can I bargain this one? Can I bargain my phone with your iPhone? Okay. Can I bargain my time? Just give me this computer. I will stay with you, but you need to provide me with that one. Those are examples of bargaining. Or, okay, I will help you with your assignment, provided you're going to help me also with my project. Yes, very good. Negotiate. Okay, make a deal. Very good. Those are the right term. Negotiate or move a deal. Yes, very good. It's kind of exchange deal. So, in the stages of the grieving process, how does bargaining occurs? For example, the person is experiencing loss. The person is diagnosed with, an acute disease, and that person is about to die 3 months. So how do you know if the person is bargaining? The person might say, Allah, please, just give me 2 more months. I just want to attend the wedding of my son. I just want to attend the graduation of my son. I just want to attend the birthday of my daughter. Okay, and after that, kalas, I can accept. That is an example of bargaining. And that is usually common among people who are grieving. You will experience that. When a person is diagnosed with acute disease, they might say, oh God, just give me 1 more month. I just want to fix, something in my life, and after that I can die. Or just give me a few more months. I just wanted to see, my children's wedding. After the wedding, it's fine. I can die. Those are are bargaining. That means that the person is entering to the third stage of the grieving process. Now, what do you think is the appropriate nursing intervention? What will you do if the patient is bargaining? Do you have any idea? I want a boy to answer this one. And I want Yusuf Hardan.
Yes, doctor.
Okay. Bargaining process. For example, I am the patient and you're the nurse. And I am only given 1 month to live because of my acute disease. And you hear me saying, oh God, just give me 1 more month. I'll just attend the graduation of my son. And after that, you can take me. I can die freely. As a nurse, what will you do?
I'll explain to you that it is all in God's hand, and I will do my best to help you at the most and to ensure your well-being and being healthy.
Okay. Is it okay for you to say that, Kalas, you will not be given 1 month. The doctor is sure it's only 1 month. After that, you will die. Are you supposed to say that to your patient?
No, you are not supposed to say that, but if the
Mhm.
patient is thinking that the doctor is wrong, he could always get a second opinion.
Okay, very good. Thank you, Yusuf. One thing that Yusuf says is um, providing spiritual support to the patient. Bargaining process during the different stages of the grieving process is normal. You accept some patients bargaining, and you cannot stop these people from bargaining. But what you can do is to support this patient, is spiritually support this patient, because this is something that you cannot stop. However, your presence, or by listening to the patient, or by encouraging the patient to verbalize, their emotions and thoughts about this process, by providing spiritual and emotional support to the patient, you can actually help our patient. Now, the patient underwent denial. The patient becomes angry to the nurse and the family members. And the patient keeps on bargaining and bargaining. At stage 4, it's where you can observe that the patients will undergo depression. How do you know if the patient is experiencing depression? You can actually observe the behaviors. You can actually observe the action of the patient. Would either be the patient might be withdrawn, the patients might not talk. The patients might just stay in the room. The patients will not provide self-care activities. The patients will what else? The patients will not talk to the husband, the patients will not talk to the children, and the patient wants to be all alone. That means the patient is having depression. Is it normal for a person to feel depressed? Is it normal for a person who is losing, who is experiencing a loss, to feel depressed? Yes, it is normal. But what is now your role as a nurse if your patient is in the process of depression? Your patient is withdrawn. Your patient doesn't want to communicate. Your patient doesn't want to interact. Your patient doesn't want to socialize. The patient doesn't want to take care of himself because your patient is depressed. As a nurse, what do you think is the important thing that you can do with your patient? I'm going to call Rim Alriani. Rim,
Yes.
okay. What do you think would be your role as a nurse if your patient is depressed? I don't want to talk to them. I just stay in my room. I'm not going to eat. I'm not going to clean my clothes. I don't want to see them. I don't want to talk to the nurse. What will you do?
Mm, I will try to talk to him and tell him that the life has many things to live for. Um, Also comfort him.
Okay, very good. Now, you cannot stop the patient from being depressed because I mentioned earlier this is a normal process. However, your presence, your caring behavior to the nurse by simply being with the nurse, being with the patient, okay, providing time to the patient, caring for the patient, and comforting the family members. Those are the most important things that is very important, you know, to the family members. Shaika says, invite his friend and prepare for a party. Okay, that's a good idea. However, in the real world, when you experience a patient who is in depression, you can really never force this person to socialize. You can never force this person to attend a party. That's why the best intervention that you can provide if your patient is in the depression stage is to be with the patient. Even without talking, your presence is more than enough to provide comfort and caring to your patient. Okay. And of course, the involvement of the family members is very important at this point. And finally, the last stage of the grieving process. I cannot read Arabic, ma'araf Arabic muna siya'y kasuha, so I cannot read your comment. So the last stage of the grieving process is acceptance. From the word itself, acceptance. It is where a person is finally able to accept that loss is a reality. The loss is there. I have accepted it. I know that my father, that my mother, or my husband, or my wife is dying. I know that I am given 1 month and I am dying. It is where you have accepted your fate. Okay? And how do you know if a person is already in the acceptance stage? This is very observable. It is where the person perhaps, prepare all the last will and testament. He tries to make sure that all his properties are already assigned to the children. What else? What else? He's starting to, to come to the reality and accept and try to avoid denying the existence of loss. Now, if you are the nurse, what would be the most appropriate nursing intervention if your patient is in the acceptance stage? In fact, some patients who are in the acceptance stage starts to retract herself from the family members because he knows or she knows that when she passed away, it will be emotionally heartbreaking, and that is acceptance. Now, while these stages of grieving is sequential in nature, stage 1, stage 2, 3, 4, and 5, there are some patients who doesn't undergo all these 5 process. Some patient might start with denial and eventually jump into depression and acceptance. Some patient might start from denial and go to anger and eventually depression and acceptance. Not all stages are being experienced by most people. But in general population, these are the different stages of grieving. I will give you a scenario. Okay, in your final written exam, I might ask a question related to stages of grieving, wherein you need to identify what stage of the grieving process the patient is at. I'll give you an example. The patient says, just give me 3 more months. And after 3 months, I can go to the hospital and I will have a chemotherapy session just after the graduation of my son. At which stage of the grieving process the patient is in? Stage 1, 2, 3, 4, 5. Stage 3. What if the patient says, okay, next. What if in the scenario it says, the patient prepares his last will and testament to be given to his children? At what stage of the grieving process? It's acceptance. Last example. The patient seek consultation from another doctor. At which stage of the grieving process the patient is in? The patient seek another opinion from another doctor. At which stage of the grieving process? Very good. The answer is denial. She doesn't believe. She doesn't refuse. She did not believe to the first doctor. That's why she asked for another doctor, look for another hospital to ask for the opinion. Now, what are the different manifestations of grieving process? Stress reaction, verbalization of loss. Crying is very, very normal. Sleep disturbance, you can sleep, loss of appetite, you don't want to eat, lack of concentration, okay? And these are, the mild reactions to loss. These are mild to moderate signs of the grieving process. However, there are some manifestations of grieving which are considered as not healthy. For example, extended time of denial. The patient has already been diagnosed several years ago about diabetes, but until now, the patient doesn't believe that she is sick of diabetes. Extended time of denial, that is not normal. Depression, why depression is not normal in the long term? Because depression might lead to suicide. Have you seen in the television those patients who are diagnosed with, advanced stage of disease or cancer? They commit suicide. And that is what we want to prevent. Severe physiologic symptoms and eventually suicidal thoughts. Okay, these are the different stages of the grieving process. Okay, do you have any clarifications or questions? Or do you have any experience of these different stages of grieving process? You can share, you can ask. All clear. Okay. Now, as mentioned earlier, almost all people experience loss. Almost all people experience grieving process. But there are several factors that affect or influence loss and grieving process in the individual. Okay? And we're going to discuss what are these. First is age. Okay. Age. Age is an example of the grieving process. Okay. So that we can have an activity here, here's what we're going to do. I'm going to flash these factors. These are 8. And I'm going to call one student to answer how it affects or how it influences loss and grieving process. I will give you 5 minutes. Okay? You do not know whom I will call. That's why you need to be ready. Is it okay? 5 minutes? Compose yourself and be ready. I'm going to ask you how each of these factors affects grieving process. Okay, 5 minutes starts now. Please compose your answer. After 5 minutes, I'm going to call student. So, let us see. I need volunteer.
Yes, Mister.
What's your name? Can you tell me your name?
Aisha.
Yes, Aisha. You can choose any factors there and you can share to us.
Okay, I chose a support system.
Okay.
Number 7.
Okay. How
I
the
think
support system influence loss and grieving process?
if the person have a strong and many people to support them, I think that will decrease the effective of sadness and feeling of lose. But if the person faces this lose and grief alone, that may affect them.
Okay, thank you. Very good, Aisha Al-Mukharshi. Support system. When a person experiences loss and that person has a huge support system, the family is there to support, the friends are there, you know, and perhaps office mates are there to support this person. That person is able to eventually um, able to cope or accept the experience of loss. Unlike with those people without support system, they might end up experiencing complicated or abnormal grieving process. And it's very difficult for them to accept the loss. Okay, thank you so much, Aisha. Who else?
Hello, teacher. Doctor.
Okay, Muna Alvazari. What factor?
Gender.
Okay, how does gender? This is a very good factor. Let me see your answer.
Okay, because the female is more emotional than the male, so they need more time to pass the situation and recover than the males, so they
Mm-hmm.
can recover from the situation fastly.
Mm-hmm.
Or more.
Mm-hmm. Thank you. I need an answer from. Thank you, Miss Muna. I need an answer from from a male student with regards to gender. Do I have a male student here? Muna says gender is a factor. Why? Because Mr. Female are in nature very emotional. Okay, when they experience loss, they express it to their emotions, and you can see that when a female patient experiences loss, you might see that the patients cry and emotional disturbed. Unlike male, what happened to male when it comes to loss and grieving process? I need to call a male student here. How does male individual reacts to loss? How does a male individual reacts to death or dying? Do we have Nahian? Nahian is here. Okay, Nahian. What do you think? How does gender influences loss and grieving process? Muna says female are emotional. They will express if they are experiencing loss, if they are experiencing grief. You know, they can show it because female are emotional. How about male? Nahian. Nahian? Just sadness. Okay, I do not know if this is also true with your culture, but in most culture, I agree with Muna. Female tends to be showy. When they are experiencing something, they tend to be emotional. And that's their way of coping with loss, death, and dying. However, most culture, if a male individual experiences loss, death, and grieving, in most instances, the experience of being emotional is not accepted. Why? Because men, society see them as strong, masculine. And if a male individual cries, the society will frown. It's a male one. Why he is crying? Is it normal for a male individual to cry? Yes, it is. But our society dictates that male should be strong, male should be firm. But Sulaiman says, yes, they may be strong or tough outside, but inside they are also emotional. But because of what the society dictates, you can see the difference how male and female manifest the grieving process and loss. Yes, because of social view, we call it a societal view. Is it normal to be for a male individual not to cry? Normally, all of us, if we experience loss and grieve a death or dying, we cry. But because of our society, male tends to keep it by themselves, not to show it to the society or to the community, or else the community will frown at him. Okay, thank you so much, Nahian and Muna, for those inputs. Who else can share other
Uh,
factors? Bushra, yes, Bushra.
the fourth factor, which is spiritual belief.
Okay, how does spiritual belief affects one?
If the person have great and strong faith in the God, and he understand the life of the cycle, and everyone will go in this way in the death, so that may decrease the sadness of the person.
Very good. You know, you will experience that if the patient is very spiritual and religious, and that person really knows what comes after death or what life comes after death. You would see a difference between a person who doesn't have a spiritual life or is not religious. You will see how the two people cope up. And you would see that a spiritual person is able to accept the loss or able to cope up with loss effectively. Very good. That's how important spirituality is, regardless of one's religion. You can be Christian, you can be Muslim, but you can be spiritual. It's a very good answer, Bushra. Next. What else?
Age.
Age. Very good. How does age affects death and dying? Do you observe some differences on how a child reacts to loss and death as compared to elderly people?
Yes, elderly people may accept it in a short time, and they may not go under all these stages,
Mm-hmm.
while the younger person may have depression and may take a long time to heal and accept the loss.
Okay, very good. Each of different stages in one's life, in the different developmental stages, have different influences when it comes to loss and grieving process. For example, children, toddler, do you think they know the concepts of death and dying? They know that they lost someone. For example, a baby or a toddler, when someone dies in his family, do you know how does this small infant or this small child process the experience of losing or dying? Of course, it is different when you have an adult person that experiences loss. Technically, the experience is different. Much more if a person is very old. The way he look at loss, the way he look at death and dying is far different when you are young. Why? Because most elderly people has come to term that loss is inevitable. They have accepted it already. Unlike with younger people who are not yet ready for death and dying, they would have a different reaction to it. That is how age affects loss and grieving process to an individual. They have their own different experiences. They have their own way of coping. They have their own way of accepting loss, death, and dying. What else? Significance of loss. Who will answer number 2? How does this affects loss and grieving process? Thank you, Bushra. Significance of loss. Oh, Mariam.
It depends on the perception of the individual and his experiencing the loss.
Okay.
Some experience it with a great sense and other with a middle. It depends on the importance of the lost person and the degree of the change that will occur because of the loss and the person's belief and value.
Okay, very good. It depends on the object lost and it depends on the significance of this object. I'll give you an example. If I lost my cell phone, my iPhone 12, the new one, you know, I might be very sad. But when a rich people, they have a lot of money, lost the same cell phone, they might react differently. They will not be sad. Why? Because of the significance of this object. See, if the object is very significant to yourself, if the lost object is significant to yourself, you would react differently. And the grieving process is different. Okay? In fact, in your book, the classic example is divorce. I know you are familiar with divorce. When someone is divorced, most wife would react emotionally, they will cry. But there are some women, when they get divorced, they are happy. It depends on the value of the object. It depends on the significance of the loss. Is it significant to that person or not? Because the reaction depends on how important or how significant an object of loss or the loss itself to a person. Very good. Who else? Who else? Who will answer cause of loss or death? How does this affect loss and grieving process? Cause of loss or death. I need male students to answer this time. How does cause? The person died because of accident. The person died because of disease. The person died because of old age. How does the causes of loss or death influence grieving process or loss? Or any volunteers from the section? Do you have any thoughts or do you have any answer? Nahian says you get more sad if the cause was strong. Okay, Shaika, do you have an answer?
Yes, we said previously the loss include loss of body image. So, for example, when the person loses the body image due to sudden reason or sudden cause, for example, car accident, the grief and sadness will be more than if the person, for example, lost the body image due to, for example, surgery, because the person will inform that he will undergo the surgery and he will, for example, develop some change in body image.
Okay, very good. That is a classic example of the cause. If the cause is accident, I'll give you a bigger example. If someone dies because of accident, the emotional impact is different. Rather than when a person dies because of old age. You see, this person dies because he is already old. It's very easy for us to accept the loss. It's easy for us to accept the death. But the reaction is different. If a person dies because of accident, or maybe this person dies because of a crime, technically the emotional response is also different. The example given by Shaika is very important also, and is related to my example that I have given. The cause is very impactful on the way how we process loss and grieving process. Thank you so much, Shaika. Okay, how about, I think we have not discussed socioeconomic status. Of course, if someone is rich, someone has a lot of money, and someone from the family dies, the husband or the wife, he is able to cope up with. Why? Because he has a lot of money to ensure or to help in the coping process. Unlike with those people who doesn't have money, doesn't have resources, they are poor. They don't have resources to help them cope up with loss. My husband has died. We don't have money. How do I send my children to school? You know, it further adds up to the grieving process. Unlike if someone died, but we have a lot of money, I need not to consider, sending my children to school because I have a money. I don't have any problem to settle my other accounts because we have a money. Most likely, the grieving process and the loss are different. Use of self-acceptance is more likely to happen when death occurs due to natural causes. Yes, if the cause of death is natural because of old age, it's very easy for us to accept. But the reaction is really different if the cause of death is by accident or by a crime. And those all affects loss and grieving process. And of course, culture also influence loss and grieving process. In fact, there are some cultures wherein emotionally showing that you are grieving is acceptable. But there are some cultures wherein you are not allowed to express your grief. You are not allowed to mourn. It depends on certain culture. I think, for example, in the Philippines, well, if you mourn, if you grieve, if someone dies from your family, whether you are boy or male, the society will accept it because that is based on our culture. We accept those things. How about your culture? I think Oman culture is also the same. Your culture allows you to express your emotions, or if you mourn or if you grieve, your culture allows you to do that. Yes, Shaika says yes. It depends, but there are some cultures wherein expressing those emotional experience, expressing grieving, expressing bereavement is not really acceptable, especially in public places. That is how culture affects each other. Okay, now I know that you have been very, you have lack of sleep because you've been studying at night. Okay, I will stop from this point, factors, and we have few slides remaining, and we're going to discuss that on Wednesday. Now, before I dismiss you, do you have any questions with regards to the topic that we have discussed? No? Very good. Okay. Now, I want Almoyed and Abdullah to stay in the group, and the others can already go. Again, I want to talk to Abdullah and Almoyed. The rest you can go if there are no other questions.